And we are back with our special edition of Coin 6 News at 4. We're asking experts your questions about coronavirus. One we keep hearing more, over and over again is testing. Why is it taking so long to get testing, and when will I or you be able to be tested?
So I can speak a little bit more to Washington's testing capabilities, but I understand what's happening in Oregon too, and I think we're running into similar problems. So right now, healthcare providers are running low on the actual swabs that you need to do the testing. And then the other problem is people need to be in the correct protective equipment to be able to do that test safely. And that is also, we're running a little bit short on that. So that is causing some strain. I know there's also just been issues with labs being able to run the test. What I would emphasize though is that if you have mild symptoms, if you wouldn't otherwise go to the doctor, you should stay home and try to isolate yourself from people as much as possible until you get better. I would seek health care if you would do so in another instance, if you're short of breath or having a problem like that. But otherwise, the best thing you can do is try to stay home and not expose people.
Really, a quick follow-up to that is, do you ever foresee everybody having to be tested for this? Will we get to a point like that?
I don't see a point. It's hard to say. That's it's hard to speculate. It depends on how many people show symptoms and whether we have the capability to do that sort of testing or not.
I want to ask Kim a question, because we were talking about this during the break, and just how much people want to help. Recently, we started something here called Kindness During Crisis, because that is so important to continue to be there for one another and show kindness to everybody. It's also just mentally important to continue to get outside and do things for yourself and for others, and people need that right now. And I think, Kim, people feel better when they know that they can be proactive and do something good for other people, right? And you guys are trying to help facilitate that.
Yeah, we have had a number of offers come in, everything from dental offices that have cut back on their routine cleanings and say, if the hospitals need masks, we will donate our masks, to a number of different folks saying, I'm looking for volunteer opportunities. We'll be setting up our own Multnomah County website in the next couple days to be able to link folks who want to volunteer to the folks who need some more help. Sometimes it's the nonprofits who want to be able to keep their food pantry open, but they need a few extra bodies on site to be able to do that in a way that's now sort of spaced out and embodies the social distancing. Meals on Wheels is a really great way for people to stay connected to our seniors, our older folks, make sure that they're healthy, make sure that they're okay mentally, emotionally. We'll have a lot of opportunities for that. We would ask volunteers to think, however, if you yourself are in one of those categories that would be more vulnerable to severe illness, like you're over 60 or have some significant health conditions, there will be ways that you can volunteer that don't put you face to face with other people. We'll try to keep everybody apart, but you might want to especially consider that you could reach out to your neighbors through text, through video chat, through phone that you know are home alone on your block, help reassure them. There'll be ways that everyone can connect, and I think if folks feel together like they can all do something together collectively and service with each other together, I think that can help also dissipate some of the anxiety that I know folks are feeling right now.
Right. I think just that website that you referenced and having everything sort of in that one collective spot for somebody to find, hey, what can I do, is really helpful. And I think it's also really a good reminder here to call somebody. We can still use the phone to call people, right? And just say hello, check in on folks. So I think that's a great idea.
We're almost out of time, but you two, you're inside this from a perspective that we don't have. How are you folks doing, and what do you need?
I am really proud of the work we're doing. I feel really energized by it every day. Partnership with City of Portland, with City of Gresham, with the state, with our partners that are neighbors, partnerships with businesses, with nonprofit organizations. Folks have really been stepping up together in a way that we are all trying to set aside differences of turf or funding concerns that we would have and just say, what's the collective common strategy that is the most good for the most people, and how can we stand that up together? It's exhausting work to do if we're in and out of it 12 to 14 hours a day. There are some stresses and anxieties. We all have limited information, so the pressure on us to make the right, best decisions can be heavy on our shoulders. But I feel that we're really lifted up collectively by the amount of goodwill that folks have towards each other.
Kim Toevs and Dr. Steve Krager, thank you very much for your time. We could ask you questions all evening
All day.
and go on and on and on and on. And tomorrow will be a new day and things will be different tomorrow. But for now, thank you both very, very much.